Good evening, everyone, and welcome to the next edition of our pop-up talk for the Dog Walking Club. I am here tonight with Dr. Tasha Wilson of Acupetvet. How are you doing, Dr. Wilson?
I'm doing great, thank you.
Good. I'm glad you could join me tonight. I know we have a very important topic coming up that we're going to discuss. But before we get into that, I want to give everyone a sense of what the Dog Walking Club is about and what these pop-up talks are about. So my name is Tracy Bisson. I'm the owner of It Takes a Village Pet Care, and I'm the founder of the Dog Walking Club. And every month we host pop-up talks, which used to be pop-up walks prior to the pandemic, but for safety purposes, they are pop-up talks. So when it is safe to do so, we will go back to our walks. We've been around a little over a year, and we have over 750 members in our group throughout New England. So it has been a great, engaged, active group of people, and we're really excited to have everyone on with us tonight. Also in the Dog Walking Club, 3 times a year, we support a charitable a nonprofit pet charitable organization in New Hampshire. And this month we are supporting Mary's Dogs. We are fundraising for them in the Dog Walking Club as well. And we have hit just over $500. And our goal at the moment is $1,000. So we'll keep pushing that and mentioning all the great stuff they do in the group. So I hope you'll join us if you're not a member. You can see that the information for joining the Facebook group for the Dog Walking Club is the ticker is scrolling across the bottom of your screen. All right, so let's get into it here because we have a very important that are available for pain relief in your pets, as well as holistic options like acupuncture, that's a mouthful, and rehabilitation.
Pet vet, a few years ago, actually, it's our 4th year anniversary this month, which I'm very excited about. But I've been a veterinarian for, goodness, I graduated in 2005, so a little over 15 years now. Was in traditional practice and then decided to look for other, actually pain management options for pets. And that's when I got involved in acupuncture, got certified acupuncture, and then I got certified in rehab therapy. I do house calls because of COVID. That's put on hold for right now, but I do have a clinic that people are coming to still, and that's where they get their treatment with acupuncture and rehab therapy.
Well, as I recall too, you've had a nice setup for COVID-19 in regards to having some meetings outside where you can practice social distancing, right?
Yes, yep. So what I've done actually is right now we're doing the basically curbside pickup, but I'll go outside in our parking lot and I'll go over exercises as long as both of us have masks on and we keep our 6 feet distance.
Perfect. Well, it's good that you were able to implement something that worked for you and still keep business open because it's, as you know, it's been tricky for pet professionals over the last couple of months.
It has, and I find with pain management it's so important. Like I consider that so essential to get their pain control. So I'm really glad I could stay open.
Awesome. Well, I know that you have a presentation for us today, so I'm going to throw that up in the stream here for everybody to take a look. And let me just hide our banner here. Perfect. So I know you had your first topic as certain approaches to pain management may be more beneficial than others. And I know you were going to give us some really good advice on different things. So let me advance the screen here for you.
Absolutely. Thank you. And if anyone has any questions, don't hesitate to go ahead and I guess they do the private chat. Is that what they use, the chat?
No, they can just post the questions below in the
you.
comment section below this broadcast, and we will ask your questions to Dr. Wilson.
Great. Yeah. So please don't hesitate. I wanted to go over 3 main things I think about when I think of pain management. Pain medications. A lot of people are familiar with that. There's many different types, and we'll talk a little bit more about that. And then there's alternative treatments. And I look at acupuncture as an option, more of a holistic type of treatment where we treat the whole body. So we can look at pain management as well as internal diseases and organ diseases. And then there's also supplements that are out there to help out with inflammation and pain management. If you want to go to the next slide, Tracy.
All right.
Great. Thank you. So pain medication, we all know how much fun it is to give our animals pain medications. I have a lot of tricks, by the way. Peanut butter works great. So don't hesitate. If you're having a hard time, wrap it in a little bit of peanut butter, and hopefully they'll be like my dogs and they'll just eat it right up. There are many different types of pain medications, and I don't know if any of you who are listening are familiar with some of them. But on the next slide, I actually go to more specifics, and that is what we call NSAIDs, which are non-steroidal anti-inflammatories. Basically, what they do is they decrease inflammation at the joint or at this area of pain. Most of you are probably familiar with Rimadyl or Acupetvet. That's one that's used a lot. There's also Medicam, Daramax. They're all different names, but they work similar, and they can work really well for pain relief. The one thing about these medications is you do have to be careful about possible side effects that are on them. You do have to keep monitoring liver and kidney values, especially when you first start. Some animals do have a reaction to them. Just like with some human meds, we have to watch for certain side effects. And this medication does sometimes have side effects. So your veterinarian probably recommend doing blood work before you start, and then blood work about a month after, just to make sure you're not having any reaction to the medication. And that primarily affects the liver and kidneys. As an animal gets older, their liver and kidney values can start increasing in general because they are getting older. So we always, as veterinarians, just keep an eye on them too. Even though we know they're not having a reaction to the medication, we want to make sure that the kidneys and liver stay healthy and that there won't be any issues with the medication staying on it. That one is the one that's usually used for pain control. And then prednisone is another one that sometimes can be used. It doesn't work as well as the NSAIDs, but depending on what's going on with the pet, it might be a good option for them. So those are the two main ones that we hear about. Gabapentin. Oh, sorry, Tracy, were you going to say something?
Oh, no, I was just saying it's really interesting.
Okay. Gabapentin is another one that is starting to be used more frequently now. It actually can work together with the above medications to actually make it more effective. So sometimes we don't see any pain relief or as much pain relief as we want, and we add the gabapentin on top of it, and it will help. We don't know how gabapentin works 100% yet, believe it or not. So it's interesting. We use it a lot for human medicine, many different things, but with the dogs, we don't know exactly how it works, but it does seem to really help out with pain control. It's used a lot in surgeries too, orthopedic surgeries. A lot of times the orthopedic surgeon will have an animal on Acupetvet or Rimadyl, and then add the gabapentin on top of it. It can make them a little sleepy too, which is always sometimes a little bit nice after surgery because you want your pet to calm down a little bit so they can rest for the first few days or few weeks. Tramadol is a medication that I would say started being used probably about 7 to 8 years ago, more routinely in veterinary medicine. It doesn't work as well as we hope. Some animals do great on it, and we keep them on long term. Gabapentin and tramadol are one of those we don't have to worry too much about the kidneys and the liver. So a lot of pets that may have some kidney or liver disease, we will go ahead and try them on these medications to help out with pain control. And some dogs do really, really well on it. What I find is most dogs will do well for probably the first 7 to 10 days, and their body kind of gets a little bit used to it, and it doesn't work as well. So I like to use it as more of like a rescue drug. So if an animal is on some other pain medications and they have a dog that just went out and hurt themselves, and there's nothing else potentially put the dog on except for the tramadol, that would be a great drug to help him get through the next couple of days while he just hurt himself playing maybe too rough with his brother. And then amantadine is a drug that a lot of people don't hear of. It is a more expensive medication, but again, it really helps out with pain, especially chronic pain. So a dog that's in a lot of pain and they're having a hard time with getting the pain level controlled, amantadine is a good one to use.
Now, do you recommend having a conversation with your vet about the different pain meds, or would you say that it makes more sense to just allow your vet to prescribe whatever they feel is the best for your dog?
Absolutely, that's a great question. So I'm really big in communicating with your veterinarian I think it's so important to ask the questions. A lot of times we'll prescribe certain medications, but it's really important that you understand why we choose what we do and what we might have to look at for side effects. So I think it's really important. When you're listening here, just write these names down. If you're concerned about your dog and pain medication, and talk to them about it and see what might be the best option for your pet, because there are definitely different options out there, and it does vary based on the individual dog.
Excellent. All right. Go to the next slide for you here.
Okay, so we're going to talk about alternative treatments before we go on. I just want to just check in to see if anyone has any questions for me regarding the pain medication. As I mentioned before, I do acupuncture rehab therapy, and a lot of my patients do come in with pain medications on board. And the main thing I think is so important is to make sure your dog is comfortable with pain. So sometimes what we do is we use this on top of the medications, and sometimes together it's a great combination. Sometimes we think, oh, you know what, we can cut back a little bit on pain medication and just use the acupuncture or rehab therapy. So that can happen too. But it's really important that we don't cut back pain medications too quickly, because the main idea is to get your dog comfortable and pain-free. So sometimes we do still have to have them on certain pain medications mixed in with the alternative therapy. I am a huge fan of acupuncture. I don't know about you guys. Tracy, have you ever had acupuncture?
I haven't.
Okay, it's amazing. And it's funny because with people, I'm one of those that it's hard to sit still for 45 minutes. And when I get my acupuncture treatment done the first time and they stick needles in me and they say, I'll be back in 45 minutes, I almost want to die, because there's no way I'm going to lay there 45 minutes not doing anything. But amazingly enough, it makes you sleepy. It really just puts you almost in a little trance. And it does the same for dogs too. Not all dogs respond that way. Some dogs, they're just so excited to be there. I'm giving them peanut butter, I'm giving them treats so they don't get in that little trance. But they are very comfortable doing it. The needles are very small, and the way acupuncture works is when you stick a needle in a dog in certain spots, it actually increases blood flow to the area of pain. It actually helps the nerves. A lot of times when we're in chronic pain or your pet is in chronic pain, it's really hard to calm those nerves down, because what they're sensing is, I don't know if you've ever done this with your own pet, but sometimes you can just touch them, just a brief touch, it shouldn't hurt, but they're in such chronic pain, it hurts them. And so acupuncture actually calms those nerves down, and it makes the nerves function more normally, so they're not sensing pain when there isn't. And then it also helps out with the pain level that they're normally having to decrease that. It releases natural opioids actually in our body. So a lot of times we think about opioids for surgery, for animals and ourselves. Well, we have them naturally in our body. So acupuncture can actually elicit the release of that, and that helps with pain control with pets. And it's an amazing thing to see with animals how well they respond to that. Cold laser therapy is another treatment that we can use to help decrease inflammation. It actually has, it causes cells to release a substance that will make the cells more healthy and less inflamed, also increasing blood flow. Cold laser therapy, I'm not sure if a lot of people are familiar with that, but it's basically a special light that you can use on the skin, and it doesn't cause pain or burning or anything like that. It gets absorbed into the skin, into the muscle, and actually decreases inflammation in that area. You can use it directly in joints too. So if you have an animal that has a knee surgery, for example, you can use that laser therapy throughout the joint, just like I said, on the outside of the joint, on the skin, and it helps decrease that inflammation. It's also used for scars too. So if an animal just has surgery, you can put the cold laser therapy light right on the scar and help decrease that inflammation and help with the scarring, so it's not so thick when they get out of surgery. Rehab therapy is basically a combination of acupuncture and cold laser therapy and other pain methods to help control pain. It's a different type of therapy that we generally don't think about with pets. So with humans, when a human has surgery or has something going on, they get physical therapy to help decrease inflammation, help them move their legs better, or their arm better. My daughter, for example, has a sprained wrist right now, and her range of motion, she can barely, well, she loves it because she can't do her homework as well. she can't use a keyboard very well because her wrists can't move as well as she wants. And so physical therapy will help her with that. And that's the same thing that we do with animals. We use physical therapy to decrease the inflammation so the joint can move better. We also do a lot of stretching and massages for rehab therapy. A lot of older dogs, it's amazing how much more comfortable they feel. We see a lot of animals sometimes with a hunchback appearance, or sometimes it almost looks like they're putting more weight on the front end than the back end. They could use a lot of massages around their neck and some stretches along their legs, just to help them feel more comfortable. And that will definitely help with rehab therapy. Sorry, with pain control. And some of the rehab therapy stuff is things that you can do with the owner too, with your own pet. So if you actually go to the other slide, Tracy, you'll see I'm a huge proponent of massages for your pet, and I'm gonna tell you they're gonna love it. So
that dog was very relaxed.
So get out your towels, your spa music, get your dog lay on the table for you.
See, this is how dogs should be treated. You know,
they
should be pampered.
They absolutely should be pampered. I think mine would agree to that too.
But well, now, Dr. Wilson, yes, these, you know, like when I look at your website, I look at your Facebook page, I see dogs in very relaxed positions, especially with the acupuncture. Is that normal? Do you ever have dogs that just get a little anxious with one of these procedures?
So most dogs get relaxed. I would say 90% of dogs will be relaxed during the session. Oh, wow. Sometimes it takes me a little bit longer to get them to sit down and to get into that position for acupuncture. And that's when I use the treats or the Kong. There are some dogs that have a hard time settling down. I usually have a Kong there and they can eat the peanut butter. I did have actually one dog. There's always a trick. There's always something that makes them more comfortable. And this one dog was eyeing our couch that we have at the clinic. And I thought to myself, I wonder if he'd be more comfortable on the couch. So we picked him up and put him on the couch. Lo and behold, he just laid there for the session. The whole time I was getting him to trying to sit still, stay seated, so because the needles can fall out if they start walking around. And all I needed to do was like just kind of read him a little bit and think, he wants to lay on the couch because that's where he's used to.
Okay.
A lot of times I find they really enjoy their treatment and they remember. And when they come back, it's easier each time. So the dogs that tend to be a little bit more antsy or anxious tend to understand what's happening. And now I have a lot of them that just go right to the dog bed I have in the clinic and they just lay there waiting for me to come around the corner with a peanut butter.
So dog laying on the couch with a Kong, getting a massage. I mean, that's living your best life right there.
Yeah, I think so. I agree.
I love it. Well, we do have some questions, Dr. Wilson, if this is a good time.
Sure.
All right. So Louise, let's see. Louise had a question about the meds, if we can go back a minute. She asked, can some of those meds be combined?
That's a great question, Louise. Yes, they can. So carprofen or the NSAIDs can be combined with a tramadol and a gabapentin. So actually you can get a pet on all three medications if you needed to. Amantadine, same thing. You just can't use prednisone with any of the NSAIDs. Those two together do not work well. They can have some side effects.
Okay. And Jennifer asks, she says, where are you located? Our tripod was just diagnosed with a possible ACL tear. Oh my goodness, that's awful.
Poor guy. Yeah. I'm located in Somersworth. And I'm sorry to hear about your little guy. That's hard. And definitely, even if it's not an ACL tear, hopefully it's not. But definitely massages, stretches, and things like that will help him, especially being a tripod, because a lot of his muscles are being used in the front end to compensate for the back end or vice versa, depending on which leg he's having difficulty with there. But yeah, I'm sorry to hear that, poor guy.
Well, Dr. Wilson, what's the best way for Jennifer to follow up with you after her dog gets diagnosed?
Yeah, absolutely. So you can email me at info at acupetvet, acupetvet.net, or you can also go to the website too, and there's a contact us form there as well, and that's at acupetvet.net. And feel free to email me now too, and let me know what's going on. We can talk about Possible things to do now, if it is a cruciate we can always get started. And if we don't know, we can at least help out with the pain control right now until that inflammation gets better, so he feels better.
Oh, that's great advice. All right. Louise says that Piper started off being anxious for her laser treatments and now she settles right in and relaxes. Is that typical once the dogs get a feel for what you're going to do?
Absolutely. Yep. They get more relaxed because my clinic's a little bit different because it's set up just specifically for acupuncture and rehab therapy. They don't get vaccines, they don't get blood work, so they come in. It's a whole different experience for them, and they realize when they're there just how relaxing it is, and how I'm not going to be doing anything that maybe they don't want me to do. So it's nice. They do relax. In fact, laser and acupuncture help release certain hormones too that help relax them. And so the more they get less anxious when they come in, the more they're receptive to that.
Oh, wonderful. Okay.
Piper does really well. I saw a picture of her just resting her head on her front paws during a session. I'm always behind her doing stuff, so I never saw that. And it was so cute.
I think dogs just know you're going to make me feel better, so I will make it easy for you.
Yeah.
All right. So Ray asks, he says, can acupuncture be a preventative care? Not that I would try it. I don't know if he means for himself or for his dog or both.
I would say, I'm not a human physician, but I would say for both would be great. But definitely, I actually have young dogs get acupuncture monthly, just basically to help keep their balance from their internal balance good. It also helps out just in general because our dogs go outside, they play rough, and just like us, they sometimes might have a little bit of neck inflammation or some tension along their back, and it'll help with that before things maybe get too tense for them and uncomfortable.
Oh, wonderful. Great. So yeah, Ray's saying that he hates needles.
Oh,
and Jennifer is telling us that her dog is a Mary's dog. So she
okay,
rescued him
wonderful.
from Mary's dogs. That's wonderful.
That's neat.
All right, so that's all the questions we have at the moment.
Okay.
Would you like me to go to the next slide?
Well, I'll talk a little bit about this slide just a little bit longer because we talked a little bit about massages, but I wanted to mention heat and cold compresses. And it's important to ask your veterinarian or your rehab therapist which one to use for what. Generally, what can happen is when your animal does hurt their knee, for example, and it's something that just happened, cold really works well. I find cold to be like the number one natural pain reliever for dogs and for us. And just doing a cold compress on the area, you want to surround it with a face cloth or something to decrease the cold being too cold on that area. But that is a great pain reliever. And then for chronic pain, I find a lot of times the lower back hurts, necks hurt, just like with us. Sometimes heat works really well. Again, I stress touch base with your vet to see which one you should use because it does depend on how old the injury is and exactly what's going on. But that's something you can do at home. And a lot of rehab therapy exercises can be done at home too, and your rehab therapist can talk to you about home exercises to help you too.
Oh, wonderful.
Yeah, if you want to go, yeah, wonderful. I love supplements. So this is a fun slide for me. So I'm sure all of you guys are familiar with different types of supplements for humans, and there are a lot out there for animals. And it's so important to know what your animal is getting and what type of studies have been done on these supplements. There are a lot of supplements out there that don't actually get the ingredients tested to make sure the ingredients they say are on the label is actually in the label, and that actually gets absorbed because it's not regulated by any federal company. So we need to be aware of that. Same thing with people. So there are certain supplements that I usually recommend just because I know that there's studies done on it and the ingredients do get well absorbed. The other thing we need to look at is the ingredients themselves because some of them don't have the studies to show that actually helps out with pain control. So if you actually want to go to the next slide, I'll talk a little bit about it. Because I'm going to go over, and can you see that? Well, I'll tell you everything on there if it's too small of a print for you guys.
I can blow it up as well so people can see it easier.
Oh, great. Thank you, Tracy. So there are different ones that we hear of. We hear a lot about glucosamine and chondroitin sulfate, and those are really good anti-inflammatories. But interesting enough, there isn't a lot of research to show that it actually helps majority of pets. some animals do really well on it, and you'll have patients who come in and say, oh yes, no, that worked great, and that's wonderful. It doesn't have side effects really, so it's very well tolerated, so it's not going to hurt. And when we first were doing supplements for animals, this was the one that we thought of doing, and this is the only one really we had available. So glucosamine chondroitin sulfate is heard of a lot, but there are other ones out there that are a little bit better. Omega-3 fatty acids are supplements that also help out with joint inflammation. But a lot of the omega-3 fatty acid supplements are not high enough doses to actually help out with joint pain. They can help out with overall skin issues, they can help out with overall health, but when it comes to joints, the dose has to be higher. So highly recommend, if you are using any omega-3 fatty acids, you want to make sure that you're on a high enough dose. So definitely touch base with your veterinarian about that. You also want to know what the source is too, where they get it from. If their source is sardines, anchovies, then you have a really good type of fatty acid. But if you have other types of fatty acids, like unfortunately salmon really sometimes doesn't have the quality that we want it to have. So we want to know where the source comes from. And you can usually find that out on their website, or you can contact the company themselves and they should be able to tell you. And if you are on the right dose of the omega-3 fatty acid, that will definitely help with joint inflammation. My two favorite ingredients that are fairly new, that have come out for, actually, you can find them now in humans, but coming out for pets, is curcumin and boswellia. I don't know if you've heard of those before. Boswellia actually is better known as frankincense if you are an essential oil person. Boswellia actually is from the frankincense, the tree in India where you get the frankincense from. And it has an enormous amount of studies to show decreased inflammation in animals and in people. In fact, with people, they see that after taking this supplement, they can squat better, they can cross their legs better. So it's a great anti-inflammatory supplement. And curcumin also is a good supplement sorry about that, guys, for inflammation. And the one thing about curcumin, again, you want to find out where the source is from, because if it's not made the right way, it might not get well absorbed. So that's really important. So those typically are the type of supplements I look for when it comes to anti-inflammatory properties in supplements.
Well, Louise has a question here. She's wondering, what brand of omega-3 fatty acid supplements do you recommend?
I like the Well-Actin Advanced. It's made by Nutramax. Nutramax is a very good quality company. They have a lot of independent companies researching their products, so you know what they say is in it is actually in it. And the advanced formula actually is made in a certain way that the absorption rate is higher, and it also is dosed appropriately for joint diseases. So that's the one I recommend.
And now, are those supplements something that you have to get prescribed, or are they over the counter for dogs?
So the Well-Actin Advanced, you might be able to get it over the counter. It is fairly new. So right now, I think only veterinary offices have it, but it might start becoming over the counter. The other supplements, it depends on the brand. So if you go to my next slide, Tracy, the brand that I like, again, I mentioned Nutramax, and that's primarily because they do a ton of research on their products. They have Cosequin and Dasequin that you can get over the counter. The Dasequin Advanced is a veterinary formula only. So you do have to get a veterinary office or a veterinary online store. The Cosequin, I'll go through these levels with you a little bit. The Cosequin was one that they originally started out with, that just had the glucosamine chondroitin sulfate. So a lot of people are familiar with that. You can find that at Petco, PetSmart, but it doesn't have as much research showing that it works as well as the other ones. So what they did is they went a step higher and made Dasequin that has avocado soybean extract that's supposed to help out with inflammation, and it also has MSM that there are some studies that show that might help with inflammation. But again, the Dasequin Advanced is the one that has my two favorite ingredients, and that's the Boswellia and the curcumin. So you have an animal that has orthopedic issues or has joints that are potentially going to lead to orthopedic issues, you want to get the Dasequin Advanced. If you have an animal that's a young animal, overall doing well, and just basically going hiking with you periodically and running with you periodically, I would do the Dasequin. But the Cosequin really isn't one that I recommend anymore.
Okay. And Ray had a comment from the last screen. He says, love frankincense for myself. Never thought of using it for our dogs.
Yep, they're talking about the essential oil, I'm assuming.
Yeah.
Ray. Yep. When it comes to essential oils, I would touch base specifically with Healthy Pets, New Hampshire, to tell you a little bit more about that. It's a different formula, the one that is in the Days-Quinn Advanced. But I do know there are some potential uses of the essential oil itself topically for animals, but I would delegate that to Healthy Pets.
And April will be coming up later in this year as a, in April, we actually had a conversation with April of Healthy Pets NH, and she did a conversation, a pop-up talk with us on essential oils, which if you're a member of the Dog Walking Club, you can actually access in the video section.
Oh, great. Yeah, she's wonderful.
I'm glad you referred to her.
She knows a lot about essential oils. So yeah,
yes,
definitely.
She does. Nutrition. Oh, this is a wonderful topic.
Yeah, so I'm just going to touch upon it briefly here. But, when we talk about supplements, nutrition has come a long way too, because a lot of our prescription diet foods for dogs with joint issues have these ingredients in it. The boswellia and the curcumin aren't there yet. Omega-3 fatty acids are, glucosamine, chondroitin sulfate are, green-lipped mussel is another great source of different types of ingredients that help out with inflammation. So when a veterinarian talks to you a little bit about nutrition, because your animal has joint issues, feel free to ask specifics about what's in it to help out with inflammation, because most likely they have some of these ingredients in it that will definitely help. And it really depends on your preference. I have a dog that had a TPLO, which basically was a surgery done for his cruciate. So I'm familiar with that surgery. And he was on food for a while. He still gets some joint food, but primarily I do the supplements. A little bit easier for me to give to him. And honestly, he loves to take it like a treat. So it's easier for me just to give the supplements over the nutrition, the prescription diet. But sometimes it's easier just to do the prescription diet for people. So it's really what you prefer, your preferences.
Well, and Dr. Wilson, didn't you recently get certified as a pet nutritionist?
I am currently working on that certification right now. Yep.
Wonderful. Good. We want to have you back when you earn that. I'm sure you'll have all kinds of other information that will be valuable to pet owners.
I would be very excited to come back.
All right. I'll move to your last slide here.
Oh, and that's just questions.
So if anybody else has any additional questions as we're wrapping up our pop-up talk here, please post them below. And if we do not get to your question or you ask it after the broadcast ends, then leave your question in the stream of this event and tag Dr. Wilson, and she will get back to you on an answer. Or like she said, you can follow up with her at her website at acupetvet.net, and her email address is info@acupetvet.net. Did I say that right?
Yes, you did.
Okay, good.
I know it's a little tongue twister there.
Well, any last pieces of advice, words of recommendation for dogs that are experiencing pain, or in Jennifer's case, you have some serious surgery potentially coming up?
Yeah, so absolutely. I highly recommend anytime you see any type of limping or any signs of pain in the dog, even if it comes and goes, touch base with your veterinarian. It might be that your dog's more prone to strains or sprains, but you can talk about different supplements to help that. And when it comes to pain control, it's never too early to start. We talked about preventative acupuncture. Definitely, if you have an animal that periodically is uncomfortable, doing maintenance therapy just to help control that is good. If you have an animal that has an ACL tear, that's periodically that limping going on, don't hesitate. Like I said, I've been through it. My dog got acupuncture regularly at home before he got his surgery, just to help decrease that pain and help him more comfortable. And when they're more comfortable, they use that leg more, and then that'll decrease the chance of them having losing muscle mass too. So that's something to think about too.
Wonderful. Okay, thank you for that information. And Lisa joined us late, but she wanted to say thank you, and she just jumped in, and she will follow up.
Oh, wonderful.
So thanks, Lisa. And you can always listen to the replay as well, which will be up after we finish this broadcast. Oh, Jennifer had another comment too. She says, it just started last night, and we have pain meds and referral for a specialist.
Perfect. You got it early. That's awesome. Good for you. And yeah, don't hesitate to reach out to any, with me. Let me say that again. Don't hesitate to reach out to me with any questions.
Oh, Louise is saying thank you. So, and I want to say thank you, Dr. Wilson. This has been extremely informative. Anytime I have a conversation with you, I'm just very grateful because you're a wealth of information. And I wanted to let people know that Dr. Wilson will be coming up for pop-up talks every Wednesday this month. And we will be having our official club talk, or also known as our PAWTY, at the end of the month, where we will have prizes, and Dr. Wilson has a special offer that will be announced in the group as well. So take a look at the events calendar. As I mentioned, if you're not a member of the Dog Walking Club, join us on Facebook. Membership is free, and you will be able to find out everything that's coming up and get it on your calendar so you don't miss it.
Wonderful. And actually, too, Tracy, before I just thought of something too with Jennifer. If she checks out my website, I do have a blog on TPLO that talks about what I went through in my own dog. And that's a surgery they usually recommend depending on what's going on. So that's something that you can look into as well. Oh, and hi, Christina. It was very nice of you to join us.
Everybody's checking in, saying hi here.
That's awesome.
Yeah, and just to expand upon that, your blog is such an amazing resource of articles and ideas and tips. And are you actually still writing from the point of view of your dog?
Yes. So Jenkins, the dog who had the TPLO, is the one who writes the blogs. Yep.
So it's great information, and it's a fun read. So I highly encourage people to go over and sign up for her blog posts.
And check out my Facebook page too. I will say I am giving away prizes this month. This is our 4th year anniversary, and usually I have a Celebrate Clients Day, but since we are all staying home a little bit more right now, I am doing something online for that. So don't hesitate to like me on Facebook. Check it out. And Jennifer, I know you're nervous about the cruciate. There's some videos of my dog after surgery, and you can see how much better he was afterwards. So yeah, so don't get stressed. I know it's hard. I was there too. Even as a vet, it was a little bit stressful.
Well, Louise has been combing your website and threw up this link. It looks like this would be a valuable page to go to and check out for Jennifer.
Awesome. Thank you, Louise.
Well, thank you very much, Dr. Wilson. I appreciate your time. I hope you have a great evening, and we'll be back with you next Wednesday for our next subject.
Wonderful. Thank you for having me. It was great to see you guys. Thanks for joining us tonight.
Thanks, everybody, for the wonderful questions. Have a great night.